What is misophonia? Misophonia literally means the hatred of sound, but that's kind of misleading because that's not exactly what it is. Misophonia is when you hear certain sounds, certain triggers, like people chewing or slurping or taking really deep breaths or blowing their nose or something that triggers you for a reason that you can't rationally understand and makes you feel anger or disgust in the moment, even though you don't want to or don't choose to, especially at the person making the sound. So, misophonia has only gained popularity in the last 10, 15 years, something people started talking about more openly, especially on social media. But it is not in the ICD 11 or the DSM 5. Perhaps it'll make its way into the DSM 6, who really knows? But there's not full agreement on what the criteria are. So that makes it a little tricky for assessment, but we'll get to that. It can also be confusing because it kind of overlaps with two other audiologically based disorders. One is phonophobia, which is a fear of sound. So certain sounds that you avoid because you're fearful of them, not the anger or disgust feeling, more like you're terrified and then avoid that potential sound. The other one is hyperacusis, which means that you're hyper aware, you're super aware, you're overly sensitive to sound. So you hear things that other people don't hear and you react to them on a level that other people wouldn't because they're processed more deeply in the brain. Phonophobia and hyperacusis are both more often diagnosed in autism spectrum and other genetic disorders. Not surprisingly, misophonia overlaps greatly with anxiety, depression, ASD, ADHD, also OCD, and PTSD. So, what do all of these have in common? They really are all disorders where you're easily over aroused or overstimulated, and there's less required for your body to go into that flight or flight response. So, how does this come to be? The idea is that there's a combination of behavioral conditioning, meaning it's something that happens as you're exposed to this trigger over time. And so the more that you hear, let's say, someone chewing, the more aversive it becomes, and then you associate it with a certain person or certain situation. And at the same time, your brain is reacting in a way that is atypical. Brain is interpreting it as almost like a threat, or almost like emotional or social pain, and then reacting with these intense feelings. In terms of assessing for misophonia, it's not something that you generally assess for on a neuropsych, though you can. And the research shows that it has a lot of overlap basically with an ADHD or ASD profile anyway. So certain aspects of memory skills, attention, response inhibition. So it all kind of goes along with that emotional reactivity, executive dysfunction profile. But there are about 10 scales that are out now, one that's for adolescents specifically. What should you do if you think you have misophonia? Of course, you can seek professional consultation through a psychiatric, psychological, or neuropsychological evaluation. There is some research to support CBT, which is pretty much effective for most things. In terms of changing some of the negative appraisal, judging yourself for your reactions, and also just reducing the avoidance. Also, DBT, which is good at managing feelings of intense anger or disgust and making sure that it doesn't become an aggressive response. There's also some research to support certain kinds of sound therapy that are also effective for tinnitus, which is like a persistent ringing in the ear. But that would be something that would be administered by an audiologist, whereas CBT and DBT and other mindfulness-based therapies would be done with a mental health counselor or psychologist. For some people, they will also benefit from antidepressants, which are like Prozac, Lexapro, Zoloft, all our well-known friends, or an anxiolytic. That's something, oftentimes a benzo, sometimes a beta blocker. So Xanax or Klonopin or propranolol. So those can be used, but they're usually used to manage the anxiety or depression. So not really to treat the misophonia specifically, but kind of what goes along with it. And the other thing that's coming out very, very new, there is a hypothesis that ITBS, a type of brain stimulation essentially, that's done very quickly, very easily, has been shown lately to have a lot of efficacy for anxiety and depression. because there's such high overlap, is suspected to be a potential helpful tool or intervention. But it's a very new idea. There's not enough research to say that that's true. I just think it's an interesting area of research and potentially could be helpful in the future. So let me know if you have any other questions, and I hope you learned something.